Few men have the courage to admit it, but it's time to speak clearly after 60. That intimate gesture of affection using your mouth to give pleasure can become risky. If done without proper care, many see it simply as a sign of affection or a way to keep the spark alive in a marriage. But the truth that few mention is that at this stage of life, overlooking small details like hygiene, posture, and frequency can open the door to inflammation, hidden infections, and even more serious issues. In my office, I see it all the time. Men proud of maintaining an active, intimate life, unaware that they may be putting their heart, prostate, and immune system at risk. Without realizing it, this is not an exaggeration, it's care and recognizing that today can prevent embarrassment, pain, and unnecessary medication tomorrow. That's why in this video I'm laying it all out, the rarely discussed side of oral sex in maturity, how to avoid risks, and how to turn this moment into something truly safe, pleasurable, and healthy. Few people stop to consider that after 60 the body can no longer handle certain positions for long without protesting, and when it comes to using your mouth to give pleasure, almost nobody talks about what it demands from the neck, shoulders, and even the lower back. In over 30 years treating mature men, I've seen how small oversights can become daily nuisances. A stiff neck, a twinge in the back, tension that begins subtly and days later keeps someone awake all night trying to find a comfortable position. The explanation is clear: as we age, the spine loses flexibility. Muscles that once withstood prolonged strain become more sensitive. Combine that with awkward positions, neck strain, or poorly supported arms, and the result is nearly always pain and muscle inflammation. Many men, out of embarrassment, don't even mention it. They pop a muscle relaxant or apply a warm compress, never realizing it all started in those intimate moments. Moments that should have been gentle became orals of endurance. To avoid these discomforts, the key is respecting your limits. Use pillows to support your chest or elbows. Avoid straining your neck forward, and above all, maintain good cervical alignment in your daily life. A well-supported neck and relaxed shoulders make all the difference. This simple care avoids weeks of pain, visits to the orthopedist, and even medication. That way, pleasure remains pleasure and never becomes a burden on the body afterward. Another overlooked aspect is the direct impact of oral sex on dental health, which becomes more delicate with age. After 60, it's common for gums to be more sensitive, tooth enamel to wear down, and saliva production to decrease, leaving the mouth vulnerable to injuries and inflammation. Many men think a quick brush is enough, but they overlook that tiny gum wounds can become gateways for bacteria during oral intimacy. Prolonged contact with fluids and repeated pressure on the tongue and teeth can cause small fissures, which in a slower defense body turn into hard to treat infections. I've treated gentlemen complaining of persistent jaw pain or mouth ulcers that wouldn't heal. On closer inspection, the culprit was a routine of intimacy without basic hygiene before and after the act. Another seldom discussed detail is how periodontal disease can worsen without the person even noticing. When gums are already fragile, any buildup of residue sparks inflammation. The AMI result: bad breath, frequent bleeding, and even tooth loss. And who wants that at a stage of life when chewing well is essential for proper nourishment? Maintaining impeccable oral health is part of ensuring safe intimacy. A careful cleaning before and after, using the right mouthwash, and regular dental checkups are simple steps that ensure those tender moments remain worry-free. That way, pleasure remains pleasure. No surprises in the mirror and no unwelcome visits to the dentist afterward. Another aspect few associate with oral sex in later years is the load it places on the neck and jaw joints. It may sound exaggerated, but it isn't. After 60, the Muscles in that area tend to lose elasticity and the cartilage in the joints becomes more susceptible to wear and inflammation. What does this mean in practice? Prolonged positions or repetitive jaw movements can trigger pain in the jaw area, annoying clicks when chewing, or even episodes of the mouth locking for those with a history of arthritis, TMJ issues, or cervical spine problems. This requires extra caution. It's not uncommon for men to describe days of tension, headaches, neck stiffness, and trouble sleeping after an intense moment, yet out of embarrassment, they never mention it to their partner or doctor, letting minor discomfort spiral into chronic conditions. Good posture is key. Supporting your arms, properly adjusting your body's height relative to your partner, and changing positions when possible makes all the difference. Small adjustments help prevent tension from building in the shoulders and neck, preserving joint health and avoiding unnecessary medical visits. Posture is everything. Respecting your body's limits means keeping intimacy alive, not turning pleasure into pain afterward. A moment of affection shouldn't be followed by aches in your neck or sleepless nights. Everything can be adapted, made lighter, more comfortable, and safer even after 60. Respecting your body's limits is a way to keep intimacy alive without turning pleasure into pain later on. A tender moment shouldn't leave lingering stiffness in your neck or rob you of sleep night after night. Every detail can be adapted to feel lighter, more comfortable, and safer even after 60. Beyond the mechanical care our bodies require, there's an invisible but crucial factor many men overlook: the strength of their immune system. As we age, our bodies' natural defenses slow down and weaken. This means that exposure to microorganisms which once posed little threat can now turn into persistent, stealthy infections. In the context of oral sex, this becomes even more significant. The female intimate area, even when healthy, naturally hosts bacteria that help balance vaginal flora. When a man brings his mouth into that area, he places his oral mucosa in direct contact with those microorganisms. For a young man with strong defenses, this rarely causes issues, but for someone over 60, especially if taking regular medications or dealing with chronic conditions, the situation changes. Tiny gum wounds, an imperceptible tongue cut, or even a canker sore can become gateway points for bacteria targeting a body that reacts more slowly. The consequences can be more serious than expected: throat infections, pharyngeal inflammation, and in severe cases, bacteria entering the bloodstream and lodging in sensitive areas like heart valves or worn joints. Many gentlemen I've treated over the years reported recurring sore throats, low-grade fevers with no clear cause, or that persistent, never-ending flu feeling, and they often never suspect the trigger was that intimate moment they believed was purely pleasurable. That's why now more than ever maintaining strong immunity is essential, not a luxury. Good nutrition, consistent hydration, regular checkups with your doctor to monitor vitamin levels, and of course extra attention to oral care form a trio that protects you internally while keeping your eye intimacy safe externally. This way each moment of closeness remains what it should be: a source of pleasure, closeness, and well-being without unpleasant surprises or long treatments afterward. There's an aspect of intimacy that can't be seen in the mirror or examined in a clinic, but makes all the difference: how a man feels inside himself after an intimate moment. For many, oral sex isn't just a physical act, it's a silent affirmation that they are still desired, useful, and capable of giving pleasure even if their body doesn't respond like it did in their 20s. With passing decades, doubts often arise. Am I still interesting? Do I still matter? Does my touch still provoke a reaction? When those questions go unanswered, they foster insecurity, fear of rejection, and little by little a drop in self-esteem. That affects every part of life at this point. Respectful and loving oral intimacy becomes much more than pleasure. It becomes a living reminder that the connection with your partner remains strong, that there is giving, trust, and reciprocity. It's as if the body speaks a language of belonging, telling you that you still matter, and that absolutely influences how you carry yourself in the world. I've seen countless older men arrive at my office weighed down by more than tests or prescriptions they carried. The shame of feeling invisible in their own bedroom, and often all it took was gently rediscovering intimacy for their eyes to shine with quiet pride again. Of course, everything has its limits and requires balance. If that moment becomes an obligation, a forced exchange, or a performance to cover up insecurities, the result is the opposite: frustration, anxiety, the sense that it's a test. That's why honest dialogue is so essential. When both partners understand that intimacy, including oral intimacy, should be a space of comfort, not pressure, everything changes naturally. Touch becomes lighter, the mind relaxes, the body responds more freely, and companionship deepens even as time continues to pass outside. Ultimately, the most powerful thing isn't the act itself, but what it symbolizes: care, presence, and the reminder that allowing yourself to feel pleasure, to give pleasure, and to be cared for cultivates self-esteem. No matter how many birthdays you've celebrated, few people talk about it, but the quality of an intimate moment depends not only on affection or technique, but also on the health of those giving and receiving that care. After 60, it's increasingly common for one or both partners to live with chronic conditions: diabetes, high blood pressure, hormonal shifts, medications for the heart or prostate. Each of these quietly influences how the body responds during oral intimacy. A common example is diabetes. Even controlled diabetic men often have more fragile oral mucosa, lower saliva production, and a greater tendency toward inflammation. Tiny injuries can serve as entry points for opportunistic bacteria, especially when glucose isn't fully stable. Add fluid exchange to the mix, and what might have been a harmless fissure can escalate into persistent gingivitis or even throat infections. Medications for hypertension, very common in this age group, often reduce natural mouth lubrication. The result: increased friction during contact, higher chance of microlesions on lips, cheeks, or gums, which in turn raise the risk of contamination by bacteria present in vaginal flora. This cycle can be broken with consistent hydration, good oral hygiene, and when needed, medication adjustments under medical guidance. Another overlooked aspect is the partner's health. Vaginal infections, even mild ones, can go unnoticed or be dismissed as temporary, but for someone practicing oral sex, they may become the starting point for cross-infection. Women in menopause often experience vaginal pH changes, increased dryness, and microfissures that disturb the balance of beneficial bacteria. Thus, what should be pure pleasure can become a shared problem. Therefore, it's essential that a couple's health walks hand in hand with intimacy. Regular visits to both urologists and gynecologists, up-to-date routine exams, and open dialogue about physical discomfort or changes all protect not just the pleasure but also the sense of peace intimacy should bring. When both partners understand their bodies must be in harmony for the mind to relax and trust, maintaining oral intimacy becomes a tender pleasure without hidden risks. This consciousness, though it may seem like mere care, in practice means fewer unpleasant surprises, fewer medications, and more time to enjoy what truly matters: connection, closeness, and the joy of living this phase with serenity. There is something no medical exam can measure, but that stands out in the journey of a man after 60. The way he embraces his own body. For many, maturity arrives as a burden, a time when they feel like They've lost the right to feel, to seek pleasure, to surrender to intimacy without fear or shame, but that's an outdated, limiting, and above all unfair belief, because the truth is that a mature man's body still holds power. It feels, reacts, and vibrates. What changes with age isn't the capacity to give or receive pleasure, but the way it happens. Now everything requires more awareness, more care, more internal listening. It's an invitation to quality, not quantity, to depth, not performance. Oral intimacy, speaking frankly, is just one expression of that closeness. It reveals much more than desire. It shows surrender, availability, connection, but as we've seen, it also demands attention to posture, oral health, immunity, emotional state, and the couple's reality. Ignoring those factors is to close your eyes to signals the body is trying to give, signals that, if respected, prolong not only health but also companionship. And this is exactly where the greatest value of intimacy after 60 lies. It's no longer driven by rushed impulses but by bonds that have grown stronger over the years. When a man chooses to keep nurturing his intimate life with care, he's actually making a silent pact with his own vitality. He's saying, I'm still here, I still care, I still want to live this fully. Mature pleasure doesn't need urgency, pressure, or comparison. It needs space, it needs listening, it needs respect for one's own limits, and above all, it needs the courage to say, yes, I deserve to feel, yes, I deserve to take care of myself. So if something in this video spoke to you, even quietly, remember, you are far from alone. Thousands of men are rediscovering this stage of life with more clarity, more freedom, and more joy. And if you want to keep receiving honest, stigma-free guidance with the seriousness your health deserves, make sure you're subscribed to this channel. That way you won't miss any content that could truly make a difference in your life. And if this video helped you in any way, leave a like. It shows that you're committed to your well-being, and it helps this message reach other men who also deserve to age with dignity, pleasure, and vitality. See you in the next video. Until then.